For 3 years, Dr. Marcus Williams had been the most respected cardiovascular surgeon at St. Mary's Hospital, the man whose steady hands had saved hundreds of lives and whose innovative techniques had earned the hospital national recognition. Nurses sought his approval, residents competed for his mentorship, and administrators proudly showcased his achievements in board meetings. But on this particular Thursday night, Dr. Williams wasn't wearing the pristine white coat that had become his symbol of authority. He wasn't surrounded by the team of medical professionals who hung on his every word during surgery. Instead, he was dressed in a simple black hoodie and jeans, having changed out of his surgical scrubs after completing an emergency procedure that had run well past midnight. His wife had called with news that their teenage son had been in a minor car accident across town. Nothing serious, but she was panicked and needed him to come immediately. Racing through the hospital's corridors toward the parking garage, Williams had felt a sharp pain in his chest and suddenly found himself struggling to breathe. At 45 years old and in excellent health, he knew the symptoms could be anything from stress to something far more serious. So he turned around and headed back toward the emergency room, the same ER where he was known as Dr. Williams or Sir by every staff member. But approaching the triage desk in his street clothes, without the white coat that served as his badge of authority, the head of cardiovascular surgery was about to be treated like any other black man seeking medical attention in the middle of the night. What happened next would reveal the ugly truth about the institution he'd devoted his career to serving, and by sunrise, the entire hospital would be forced to confront the prejudice hiding behind their oath to do no harm. The fluorescent lights in St. Mary's Hospital emergency room cast their familiar harsh glow across the waiting area as Dr. Marcus Williams approached the triage desk. One hand pressed against his chest where the pain had been steadily worsening over the past 10 minutes. The night shift was in full swing, with the usual mix of patients filling the plastic chairs, a construction worker with a bandaged hand, an elderly woman coughing into a tissue, a young mother holding a feverish toddler. Marcus had walked through this same emergency department countless times over the past 3 years, usually in his surgical scrubs or pristine white coat, instantly recognized and greeted with the deference accorded to one of the hospital's most prestigious surgeons. Tonight was different. Dressed in the dark jeans and black hoodie he'd thrown on after his late surgery, Marcus looked like any other tired man seeking medical attention in the early hours of Friday morning. The triage nurse, a middle-aged white woman named Janet Morrison, whom Marcus had seen in the halls but never formally met, was focused on her computer screen when he approached the desk. She glanced up briefly, her expression already shifting to one of mild irritation before he'd even spoken. "Can I help you?" Janet asked, her tone suggesting that helping was the last thing she wanted to do. Her eyes took in his appearance. The hoodie, the jeans, the exhaustion on his face, and Marcus could practically see her making assumptions about why a black man would be seeking medical attention at once. "I'm experiencing chest pain," Marcus said calmly, though the discomfort was making it difficult to breathe normally. "It started about 15 minutes ago. Sharp pain, radiating to my left arm." Janet's expression didn't change. She didn't reach for her blood pressure cuff or show any of the urgency that cardiac symptoms typically warranted. Instead, she leaned back in her chair and folded her arms across her chest. "Uh-huh," she said skeptically. "And I suppose you need pain medication for—" Marcus blinked, taken aback by the implication. In his 3 years at St. Mary's, he'd witnessed this kind of dismissive treatment directed at other patients, particularly patients of color, but experiencing it firsthand was jarring. "I'm not seeking pain medication," he said carefully. "I'm concerned about cardiac symptoms that need immediate evaluation." Janet snorted softly. "Sure you are. Look, we get a lot of people in here claiming chest pain when what they really want is drugs. You're going to have to wait like everyone else, and when the doctor sees you, he'll decide if your cardiac symptoms are real or not." The irony of the situation wasn't lost on Marcus. He was standing 3 feet away from a woman who had no idea she was dismissing the medical expertise of the very doctor who would likely be called to evaluate any serious cardiac case that came through those doors. But more than irony, he felt a growing anger at the casual prejudice being displayed. "Ma'am," Marcus said, keeping his voice level despite the pain in his chest and the frustration building inside him, Chest pain with radiation to the left arm is a classic presentation of cardiac distress. I'm requesting immediate triage evaluation. Janet's eyes narrowed. Oh, so now you're a doctor too? Let me guess. You stayed at a Holiday Inn Express last night? She turned to another nurse standing nearby, a younger woman named Rebecca who was organizing medical supplies. Rebecca, come here. We've got another one who thinks he knows more than the medical staff. Rebecca approached the desk, and Marcus could see the same assumptions forming in her expression as she took in his appearance. What's the problem? She asked Janet, not even looking at Marcus direct. This gentleman, Janet said, emphasizing the word in a way that made it sound like anything but a courtesy, is claiming cardiac symptoms. Says we need to evaluate him immediately because he apparently knows all about medicine. Marcus felt the pain in his chest intensify. Whether from the physical condition or the stress of the situation, he couldn't tell. I'm simply asking for appropriate medical attention for symptoms that could indicate a serious condition, he said, his voice tighter now. Rebecca shook her head dismissively. Sir, we have real emergencies to deal with tonight. If you're having an actual medical emergency, we'll get to you when we get to you. If you're here looking for drugs, you might as well leave now because it's not happening. The assumption was so blatant, so casually cruel, that Marcus felt his professional composure beginning to crack. Here he was, in his own hospital, being treated with the kind of prejudice he'd fought against his entire career. But what disturbed him most was the realization that this was probably how these same staff members treated other patients who looked like him. Patients who didn't have his education, his position, his ability to advocate for themselves. I need to see a physician, Marcus said firmly. Now, Janet rolled her eyes dramatically. You'll see a physician when it's your turn. Until then, you can take a seat over there and wait like everyone else. She gestured dismissively toward the waiting area. And I suggest you adjust your attitude, because the doctor doesn't appreciate patients who think they can demand special treatment. Marcus stood at the desk for a moment longer, processing what had just happened. In his 3 years as head of cardiovascular surgery at St. Mary's Hospital, he had never imagined that his own staff would treat anyone, let alone him, with such blatant disrespect and prejudice. The pain in his chest was definitely worsening, but now he was facing a dilemma that no medical school had prepared him for. How to get appropriate medical care when the very people supposed to provide it had already decided he didn't deserve it. He walked slowly toward the waiting area, his mind racing despite the physical discomfort. Part of him wanted to immediately reveal his identity, to watch these nurses scramble to apologize and provide the care they should have offered from the beginning. But another part of him, the part that had spent years advocating for equitable patient care, wanted to see how far this would go. How many other patients had been treated this way? How many people had suffered because of the prejudices of staff members who were supposed to heal without regard to race, class, or appearance? Marcus took a seat in the waiting area, watching as other patients were called back for evaluation. A white college student who appeared intoxicated was immediately taken for assessment after complaining of a headache. An elderly white woman with what appeared to be minor cold symptoms was escorted to triage within minutes of arrival. Meanwhile, Marcus sat with increasingly severe chest pain, checking his watch as precious minutes ticked by. 20 minutes passed, then 30. The pain was no longer just discomfort. It was becoming genuinely concerning. Marcus knew enough about cardiac medicine to recognize that if this was indeed a heart attack, every minute of delay increased the risk of permanent damage or death. The irony was crushing. The hospital's head of cardiovascular surgery was potentially having a cardiac event while being denied care by his own staff. At the 40-minute mark, Marcus approached the desk again. Janet looked up with undisguised annoyance. You again, she said. I told you to wait. The chest pain is worsening, Marcus said, no longer able to keep the strain out of his voice. This could be a medical emergency. Could be, Janet said mockingly. Or it could be gas, or anxiety, or withdrawal from whatever you were taking earlier. She leaned forward, her voice dropping to a venomous whisper. Look, I've been doing this job for 15 years, and I can spot a drug seeker from across the room. You can sit there and wait, or you can leave. Those are your options. Marcus felt something inside him snap. The combination of physical pain, professional outrage, and personal humiliation had reached a breaking point. "I want to speak to the attending physician," he said, his voice carrying an authority that made Janet blink in surprise. "The attending physician doesn't have time for every person who walks in here demanding attention," Janet replied, but there was something in Marcus's tone that had clearly unsettled her. "Then I want to speak to the nursing supervisor," Marcus continued, his voice growing stronger despite the pain in his chest. "The nursing supervisor doesn't come in until 7 a.m., Rebecca interjected, having overheard the conversation. "Look, sir, you're creating a disturbance. If you can't wait quietly like the other patients, we're going to have to ask security to escort you out." The threat of security being called on him in his own hospital, while he was potentially having a cardiac event, was so outrageous that Marcus almost laughed. Almost instead, he felt a cold determination settling over him. "Call security if you want," he said calmly, "but I guarantee you that conversation is going to be very interesting." Something in his tone made both nurses pause. There was a confidence, an authority in his voice that didn't match their assumptions about who he was. Janet and Rebecca exchanged glances, uncertainty flickering across their faces for the first time since the interaction had begun. But before either nurse could respond, the automatic doors to the emergency room burst open and a team of paramedics rushed in with a patient on a stretcher. "Incoming trauma," one of the EMTs called out. "Motor vehicle accident, multiple injuries. Need surgery, consult immediately." The emergency department suddenly erupted into controlled chaos. Dr. Jennifer Hayes, the attending emergency physician, emerged from one of the treatment rooms and began coordinating the trauma response. Marcus watched from the waiting area as his colleagues, people who knew him, respected him, had worked alongside him for years, rushed to save a life. "We need cardiothoracic surgery," Dr. Hayes called out, reviewing the patient's injuries. "Page Dr. Williams immediately." Marcus felt a grim smile cross his face. Even in the midst of his own medical emergency, his expertise was being called upon. He stood up slowly, the chest pain making movement difficult, and walked back toward the triage desk. "Excuse me," he said to Janet, who was frantically trying to locate contact information for Dr. Williams. "Not now," Janet snapped without looking up. "We have a real emergency here." "I know," Marcus said calmly. "You're looking for Dr. Williams." "Marcus Williams, head of cardiovascular surgery," Janet said distractedly, still focused on her computer screen. "Do you know if he's in the hospital tonight?" Marcus waited a beat, letting the moment stretch. "As a matter of fact," he said, his voice carrying clearly across the suddenly quiet triage area, "I do know where Dr. Williams is." Janet looked up impatiently. "Well, where is he?" Marcus looked directly into her eyes, his voice steady and clear. "You're looking at him." The silence that followed was deafening. Janet's face went white as she stared at Marcus, her brain struggling to process what he'd just said. Rebecca dropped the chart she'd been holding. Other staff members who had overheard the conversation turned to look, their expressions ranging from confusion to dawning horror. "What did you say?" Janet whispered. Marcus reached into his pocket and pulled out his hospital ID badge, the one that identified him as Marcus Williams, Chief of Cardiovascular Surgery. He placed it on the desk in front of Janet, who stared at it as if it might explode. "I said," Marcus repeated, his voice now carrying the full authority of his position, "that I am Dr. Marcus Williams. The same Dr. Williams you've been refusing to treat for the past hour while I've been experiencing cardiac symptoms. The same Dr. Williams whose medical expertise you've been mocking. The same Dr. Williams who signs your performance evaluations." The color drained completely from Janet's face. Rebecca made a small, strangled sound. Other staff members began backing away, suddenly very interested in tasks that took them to different parts of the emergency department. Dr. Hayes, who had been coordinating the trauma response, heard the commotion and turned around. When she saw Marcus standing at the triage desk, her face lit up with relief. "Marcus! Thank God you're here. We have a complex cardiac trauma that needs immediate surgery. Are you ready to scrub in?" Marcus didn't take his eyes off Janet as he responded. "Actually, Jennifer, I'm here as a patient. I've been experiencing cardiac symptoms for over an hour, but your triage staff has been refusing to evaluate me because they assumed I was a drug seeker." Dr. Hayes looked confused, glancing between Marcus and the now terrified nursing staff. "I don't understand. Marcus, you're having cardiac symptoms. Why aren't you being treated?" "An excellent question," Marcus said, his voice carrying across the emergency department. "Perhaps Janet here can explain why she felt comfortable denying medical care to someone she assumed was just another black man looking for drugs." The weight of what had happened was beginning to settle over everyone in the vicinity. Hayes looked horrified. Other staff members were finding excuses to be elsewhere, and Janet appeared to be on the verge of a panic attack. "Dr. Williams," Janet stammered. I didn't to know. I mean, I never would have." "You never would have what?" Marcus asked, his voice sharp with controlled anger. "Never would have provided appropriate medical care to someone based on their race. Never would have assumed the worst about someone because of how they looked. Or never would have done it if you'd known who I was." Janet's mouth opened and closed, but no words came out. The distinction Marcus was drawing was crucial, and everyone in the emergency department understood it. The question wasn't whether Janet would have treated Dr. Marcus Williams differently. Of course she would have. The question was why she felt justified in treating any patient the way she had treated him. Dr. Hayes stepped forward, her medical training overriding the shocking social dynamics of the moment. "Marcus, we need to get you evaluated immediately. Cardiac symptoms with this duration." "How long have you been waiting?" 57 minutes, Marcus said, checking his watch. 57 minutes during which I've been experiencing progressively worsening chest pain with radiation to my left arm, and your triage staff has refused to take my vital signs, perform an EKG, or provide any medical evaluation whatsoever." The medical implications hit Dr. Hayes like a physical blow. If Dr. Williams was indeed having a cardiac event, nearly an hour of delay could mean the difference between full recovery and permanent heart damage, or worse. "Jesus Christ," she muttered, then immediately began taking charge. "Rebecca, get Williams into Trauma Bay 2 immediately. I want a full cardiac workup. EKG, chest X-ray, blood work, the works, and get cardiology down here stat." As the medical team finally began providing the care Marcus should have received an hour earlier, he found himself in the surreal position of being both patient and the physician everyone was trying to please. The EKG showed abnormalities consistent with cardiac stress, though thankfully not a massive heart attack. Blood work revealed elevated cardiac enzymes, indicating some heart muscle damage from the prolonged delay in treatment. But the physical condition was only part of the story that was unfolding at St. Mary's Hospital that night. Word of what had happened spread quickly through the hospital. By 3 a.m., Dr. Patricia Chen, the hospital's chief medical officer, had arrived to personally assess the situation. By 4 a.m., Janet Morrison had been placed on administrative suspension pending a full investigation. By 5 a.m., the hospital's board of directors had been notified of what the chief counsel was already describing as a significant liability event. But for Mark, lying in the cardiac monitoring unit with IV lines in his arm and his heart rhythm being continuously tracked, the most important realization was just how many other patients had probably experienced exactly what he'd gone through, except they hadn't had a medical degree and department head authority to eventually demand proper care. Dr. Hayes stopped by his room as the sun was beginning to rise. "How are you feeling?" she asked, though her expression suggested she was asking about more than just his cardiac symptoms. "Physically, I'll be fine," Marcus said. "Some heart muscle damage from the stress and delay, but nothing permanent. Emotionally and professionally, that's a different story." Dr. Hayes sat down in the chair beside his bed. "Marcus, I had no idea that kind of behavior was happening in our emergency department. I mean, I knew there were sometimes complaints about staff attitudes, but I never imagined." "That's the problem," Marcus said quietly. "Those complaints weren't taken seriously because they came from patients who didn't have the power to make themselves heard. How many people do you think have suffered because Janet Morrison and others like her decided that certain patients didn't deserve proper medical care?" The question hung in the air between them. Dr. Hayes knew, as they all knew that the answer was probably more than anyone wanted to acknowledge. "What happens now?" Dr. Hayes asked. Marcus was quiet for a long moment, watching his heart rhythm trace across the monitor beside his bed. "Now," he said finally, "we figure out how to make sure this never happens to anyone else. Because the only difference between me and the patients who get turned away or ignored is that I had the privilege of being able to reveal who I was. Most people don't have that privilege." Over the following days, Marcus's experience became a catalyst for sweeping changes at St. Mary's Hospital. The incident triggered a comprehensive review of emergency department protocols, mandatory bias training for all staff, and the implementation of patient advocacy procedures that ensured complaints about discriminatory treatment would be taken seriously. Janet Morrison was ultimately terminated, not just for her treatment of Dr. Williams, but because the subsequent investigation revealed a pattern of discriminatory behavior toward minority patients that had been overlooked for years. Rebecca received a formal reprimand and was required to complete additional training, though she remained employed at the hospital. But perhaps the most significant change was in Marcus himself. His experience as a patient in his own hospital had given him a perspective on healthcare inequity that no amount of medical training could have provided. He began working with patient advocacy groups, speaking at medical conferences about implicit bias in healthcare, and implementing changes within his own department to ensure that every patient received the same level of care regardless of their race, appearance, or perceived social status. 6 months after that terrible night in the emergency room, Marcus received a letter from a young black woman named Keisha who had read about his experience in a medical journal article he'd written. She described how his story had given her the courage to file a complaint about discriminatory treatment she'd received at another hospital, treatment that had delayed her cancer diagnosis by several crucial weeks. "Williams," she wrote, "your willingness to speak out about what happened to you probably saved my life. Because you had the courage to demand better, I found the strength to demand better too." Marcus kept that letter in his office, a reminder that sometimes the most important healing happens not in operating rooms, but in the moments when people find the courage to demand the dignity and respect that every human being deserves. The night that Dr. Marcus Williams was refused care in his own hospital had been a moment of profound crisis, but it had also been a moment of revelation. Not just about the prejudices that existed within the medical system, but about the power of speaking truth to authority and demanding change. As Marcus often told the medical students who rotated through his department, medicine is supposed to be about healing. But sometimes, before we can heal others, we have to be willing to confront the sickness within our own institution. That night in the emergency room taught me that wearing a white coat doesn't automatically make you a healer. How you treat the most vulnerable patients when no one important is watching, that's what makes you a healer. The story of what happened at St. Mary's Hospital became more than just an incident report or a personnel matter. It became a lesson about the insidious nature of prejudice, the courage required to confront it, and the possibility of creating change when people in positions of authority are willing to use their privilege to protect those who don't have a voice. And every time Marcus walked through the emergency department, now wearing his white coat, immediately recognized and respected, he remembered what it felt like to be invisible, dismissed, and denied care. That memory, painful as it was, served as a constant reminder of why his work both as a surgeon and as an advocate for equitable healthcare was so important. Because in the end, the measure of a hospital, like the measure of a society, isn't how it treats its most powerful member. It's how it treats the people who have nowhere else to turn when they need help the most.